Welcome back to Midday Kentucky, everyone. Well, lung cancer is a common form of cancer that is one of the easiest to prevent. Joining me today is Dr. Erica from Clark Regional Medical Center, and we're talking all about cancer prevention. How are you, my friend?
Thank you. Thank you for having me.
Okay, I had no idea lung cancer was the easiest to prevent. How serious is it in the state of Kentucky?
It's very serious.
I was thinking because of smoking.
Smoking, because smoking contributes to 80 to 90% of all lung cancers.
Really?
And we have one of the highest smoking rates in the country.
Okay.
And therefore, we have one of the highest lung cancer rates in the country.
Does dipping, is that...
It's still nicotine, and it still will increase your rates of cancer.
Yeah, okay. Okay, let's talk to me about it. Of course, simple, everyone. How do you prevent it? You don't smoke.
Right.
All right, but it is difficult for people.
Correct. It's very difficult once you start to stop. But ask your doctor. There's many other things out there that you can have that can help you stop smoking. And once you stop smoking and you've been smoke-free for 15 years, your risk of lung cancer goes down to the same rate as someone else who has never smoked.
Hold on, say that again. If you've stopped...
If you stop smoking,
yes,
15 years later, your risk for lung cancer is the exact same as someone else's that does not smoke. Right.
That is amazing.
It's never too late to quit smoking.
We all know that, and you know, I was a smoker, so you know, I completely agree. How do you know if you have lung cancer without being diagnosed? If you just have that gut feeling?
So that's the problem with lung cancer, is most people are diagnosed late in the disease process because all of the symptoms are very vague. You know, it's cough. Maybe you have a cough that all of a sudden seems to be a little bit different. Maybe you coughed up blood. Maybe all of a sudden you have weight loss that you can't really explain. So then that's when you need to go to your doctor and ask them, do you need to be screened for lung cancer?
Okay, speaking of screening, let's just put up a screen that we had built. Now, this is for people between 55 and 80. Talk to me about the screening.
Sure. So low-dose lung cancer screening CAT scans came out several years ago, and your insurance, including Medicare, covers this. So if you're aged 55 to 80, if you are either a current smoker or have been smoking within the last 15 years, or you actually have a 30-pack year smoking history, which means the way they calculate your smoking history is it's either 30 years of smoking a pack a day or 15 years of smoking 2 packs a day. So if you have that much exposure, you should be getting a CAT scan once a year to scan for lung cancer. Wow.
That's a lot of cigarettes a day, huh?
It is, but you'd be surprised at how many people a day I talk to that have way more than that.
Really? What do you, okay, do you mind if I ask?
Sure.
Because, you know, people, you know, I smoked for 20 years, everyone. I'm not going to hide that. And people used to say to me, we never thought you were a smoker. Because I always was very aware, because I didn't want people to know that I smoked heavily. What are you seeing? What amount of people smoking?
Oh, it's much more common here. I actually trained in Texas. I'm from Kentucky originally. And you know, it's very common to see people smoke here. I remember my daughter never saw someone smoke until she was 4, and she asked, what is that?
And how many cigarettes is the average person smoking here in Kentucky?
I hear a big range. Some people say half a pack. I have up to 3 packs a day.
Oh my gosh.
Right.
Yep. Okay. What happens if I see something on my CT scan?
So just because you see something, they'll call it a pulmonary nodule.
Yes.
Doesn't necessarily mean it's lung cancer. It can actually just be scarring from something else.
Oh.
Right. So just because you have something on that cancer screening doesn't mean you have to get worried. Okay. It means you need to go to your doctor. They need to look at it. You have to see what size it is, because size is a big determining factor of what you do next. Maybe something as simple as just following the CAT scans, looking at it and watching it for 2 years, make sure it doesn't get any bigger.
Yeah.
If it's large enough, you need to have it looked at, which means a biopsy.
Okay, and of course we all know that's all part of your insurance as well.
Correct.
Listen, we think you're amazing. I want you to come back and talk more about this. Dr. Erica, we appreciate you. If you want to find out more information about Clark Regional Medical Center, there it all is up on the screen, everyone. You know, it's a really beautiful hospital. It really is lovely. We appreciate you as well. Stick around for the latest in Hollywood news and a check of your weather forecast, everyone. You're watching Midday Kentucky.